Some MS symptoms are just annoying. Well, hello and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam and I've been living with multiple sclerosis for 38 and a half years. And in that time, I've experienced a number of different exciting symptoms that MS will send. And one of the most annoying, although in my case thankfully not painful, is restless leg syndrome. I'm starting again to be dealing with it, although it doesn't happen all the time. It's been creeping up lately, and most nights I find that I am dealing with it. But at the same time, there was an article that Professor G put out in his MS selfie post, and so I looked at what he had to say, and I thought, well, that's interesting. I should also look and see what else is being talked about in the wide world of medical research. So I will share with you some of the things that I have found. Well, this article seems to be comprehensive and it's quite up to date, so I thought we'd just look at this one because it answers most of the questions that we might have about restless leg syndrome. So you'll often hear the acronym RLS when people are discussing restless leg. In this NIH website, the National Institute of Neurological Disorders and Stroke, we do find out more about restless leg syndrome. First of all, what is it? And according to this site, RLS is also known as Willis-Ekbom disease. Now, that's a new one on me. I had never heard that before, so now we've all learned something. It's a neurological disorder that causes unpleasant and uncomfortable sensations in your legs and an irresistible urge to move them. Symptoms commonly occur in the late afternoon or evening hours and are most often intense at night when you are resting. And that would certainly be the case for me. I would definitely attest to that. I've been finding that in the evenings, as I'm sitting and talking with folks, I have this irresistible urge to move not just my knees, but also my ankles. I'm constantly twisting my foot around, trying to get my ankle to behave itself. And that only happens in the evening. I wake up in the morning and I'm fine, and I don't even think I wake up in the middle of the night with any trouble. It's just those evening hours, late afternoon and evening. It seems like that's pretty typical. And then they say here that moving the legs or walking typically relieves the discomfort, but the sensations often recur once the movement stops. And that would be true. And then they say that it's a sleep disorder, and that makes total sense because it's going to make it very difficult for you to fall asleep. And that is what I've said earlier, is that it's annoying because you try to get comfortable, and then here your knees are saying, I'm not comfortable, you need to move me around. And you keep shifting and reshifting and reshifting and turning this way and turning that way. And it does really disrupt sleep. And if your sleep is disrupted, of course, your other symptoms are going to be made worse because you're tired before you even begin. And then they say it's estimated that up to 7 to 10% of the U.S. population have RLS, which can begin at any age. It says it occurs in both males and females, although females are more likely to have it, and that might possibly be because females are also more likely to have MS, and whether those two things have a causal link or a correlative link, right? Correlation is not causation, and we need to make sure we always keep that in mind. But in this case, we've got two different factors, both of which seem to be more common in females. Many individuals who are severely affected, they say, are middle-aged or older, and the symptoms typically become more frequent and last longer with age. Oh, good. That's something new I get to look forward to then. RLS is generally a lifelong condition for which there is no cure. However, treatments are available to ease the symptoms. Well, I think it would be kind of hard to cure it because I'm not really sure they understand what exactly is going on with it. So the common signs and symptoms, and maybe many of you are familiar with these. The sensations begin after rest. They typically occur when you're inactive and sitting for extended periods. For example, when taking a trip by plane or watching a movie. Oh yes, some of my plane trips haven't been very comfortable, I have to say, and even those weren't in the evening necessarily. I just find that my legs, being kind of on the longer side, don't conform very well to the seat on a plane. And then secondly, relief of discomfort with movement. So if you are able to move in some way, you can get at least temporary relief from the RLS. Although once you stop moving, generally the RLS starts back up again. And then finally, worsening of symptoms at night with a distinct symptom-free period in the early morning. Yes, that's very true. I never get that in the early morning. You might have difficulty falling asleep and staying asleep. You may also note a worsening of symptoms if your sleep is further reduced by events or activity. And I'm not sure, I haven't really correlated that. I'd be interested to know if you have seen a correlation between perhaps your level of anxiety, or some event that keeps you from getting a good night's sleep, maybe a crying baby or a loud thunderstorm or something that just disturbs your sleep anyway. Does the restless leg add to that? And they say here, RLS can cause you to experience the following. You can have changes in mood. Well, yeah, certainly if you're annoyed by your RLS or if it's affecting your sleep, your mood is bound to be affected by that. Exhaustion and daytime sleepiness. Okay, I do experience some of that, and I have to wonder if that isn't related in some way. Problems concentrating. Possibly so. Impaired memory. Again, possibly so. Decreased productivity and depression and anxiety. So those are all symptoms that we deal with because we have restless leg syndrome. And some of us don't deal with all of those, and all of us deal with them to varying degrees. But those are at least some of the things that happen because we have restless leg syndrome. Even though it doesn't cause physical pain in many cases, it still has a detrimental effect on the quality of our lives. And then they talk a little about periodic limb movement of sleep, whether it's the same or different from restless leg. They say that more than 80% of people with restless leg syndrome also experience periodic limb movement of sleep. PLMS is characterized by involuntary leg and sometimes arm twitching or jerking movements during sleep that typically occur every 15 to 40 seconds, sometimes throughout the night. I am going to have to ask my husband about that because he's never said a thing, and I'm not quite sure I do that. But how would I know if I'm asleep? So I'm going to have to ask him about that. It says, although many individuals with RLS also develop PLMS, most people with PLMS do not experience RLS. Talking about folks who are more likely to have restless leg syndrome, and we'll just skip down here to the bullet points. If you have end-stage renal disease and hemodialysis, you're more likely to have restless leg syndrome. Neuropathy or nerve damage, well, that would pretty much include everyone with MS, I would think. Sleep deprivation and other sleep conditions such as sleep apnea. Pregnancy or hormonal changes, especially in the last trimester. In most cases, symptoms usually disappear within 4 weeks after delivery, and then finally use of alcohol, nicotine, and caffeine. I think there's a couple of points that are important looking at this list. Number one, it looks to me that other things may cause RLS besides MS. As we saw earlier, a good portion of the population has this condition, even if they don't have MS. But what I think we often fall into is if we have MS, we have this tendency to attribute anything that goes wrong, especially if it seems nerve-related. We say, oh, it's because of my MS, and then we don't get anything checked out. Professor G talks about this in his podcast. Don't assume that just because you have MS, your restless leg syndrome is attributed to that. There may be something else going on. Most of us would know if we had end-stage renal disease, but we might not really notice that it's related to, for example, our use of alcohol, nicotine, or caffeine. And that would be one thing that would be easy to try. If you're having a lot of trouble with restless leg and you do use alcohol, nicotine, or caffeine, try eliminating or reducing those, at least for a period of time, and see if that makes any difference. But in any case, you might want to mention it to your doctor the next time you're there. And I would recommend mentioning it to your primary care doctor rather than your neurologist. Not because I don't trust the neurologist, but because, okay, let's face it, when all you have is a hammer, everything looks like a nail. And when you show up at the neurologist office and you talk about problems that sound like they could be neurological, the chances are really high that the neurologist is going to prescribe something based on thinking that it's related to MS, which it may well be. And what they prescribe may well take care of the RLS, but you wouldn't then know if there was some other underlying condition going on. So you might mention it to your primary care doctor, and they may know some more general things about what might be the cause of your restless leg. And maybe they can recommend some treatments that the neurologist might not think to mention. Just saying. And then if we scroll down just to the section on treating RLS, because I think that's why everyone has tuned into this video. They want to know, well, okay, I have it. What can I do about it? Here are some suggestions that they make. And I've heard these in other places, but this is a nice list. I'd say it's fairly comprehensive. So let's go through it. They talk about iron supplements, and I have heard this in several places, that if you are iron deficient, you may have problems with restless leg syndrome. And I think a number of us, especially those of us who are on more of a plant-based diet, we may not be getting enough iron. I've also been hearing a lot about how iron supplements that you take over the counter are sort of contraindicated because you can't control the dosage, and getting too much iron is just as bad as having a deficiency. But again, you might mention this to your primary care doctor and see if they have any suggestions. The next one, anti-seizure drugs. This one makes some sense to me because RLS does almost act like little seizures, doesn't it? Little localized seizures. And then they talk about having approved gabapentin for the treatment of moderate to severe RLS. When I was in the hospital, I was given gabapentin as a pain suppressant, and after I left the hospital, I stayed on it for a while. What I discovered was I was no longer having trouble with restless leg syndrome. But when I weaned myself off of the gabapentin, I found that my RLS came back. So I would definitely say that gabapentin is effective in eliminating RLS symptoms. If you don't mind being on a prescription medication, gabapentin is not one of the more expensive ones, and it doesn't really have any dire side effects. So I guess I would recommend it. I got off of it mainly just because I wanted to see if I could find another way to deal with my restless legs, and I'll talk more about that later. And then they talk about dopaminergic agents, and they say these drugs, which increase dopamine in the brain, can reduce symptoms of restless leg syndrome when taken at night. The medication may be effective when used intermittently, but not daily, because long-term use of dopaminergic drugs can eventually worsen symptoms and cause other complications. The next one they recommend is opioids. I'm not a real fan of opioid drugs. They've listed some there. They're sometimes prescribed, but their side effects in my book are just too serious to make them worthy of consideration for something that doesn't cause actual pain. I was sent home with some oxycodone. I got off that very, very quickly because it causes, among other things, constipation, and who needs that? And then finally, benzodiazepines. Medications such as clonazepam or lorazepam are generally prescribed to treat anxiety, muscle spasms, and insomnia, and they can help individuals get more restful sleep. And so you might look into that too. And then they talk about lifestyle changes. This is the part that I always like because these are things we can do ourselves without any doctor writing us out a prescription. And these are the following. Avoid or decrease the use of alcohol, nicotine, and caffeine. I've already talked about that. It may be one, or it may be all, or it may be some, and maybe a certain quantity that will make the difference. And you might want to just experiment and see what works. Change or maintain a regular sleep pattern. That's good for many reasons. Try moderate regular exercise. Also, I have heard that recommended. I've also heard that intense aerobic exercise can actually cause restless leg syndrome, or make it worse, I should say, along with cramps. So that's something that most of us with MS don't find ourselves doing, high intensity exercise, at least not to a huge long degree. So we may not have that problem really, but it is an interesting case of where there can be too much of a good thing. And then massage the legs or take a warm bath. Now in the leg massage, that's a great idea. Professor G in his podcast talks about massage, and he said, make sure that your massage is in a circular motion rather than up and down, because I guess that works better with the muscle to release the tension that's in the muscle. I have never tried taking a warm bath. That's an interesting point. I wonder if wrapping your knees in a heating pad would do the same thing. As they say in the very next bullet, apply a heating pad or ice pack. So that's probably worth a try. I might just experiment with that and see if it works. Use foot wraps especially designed for people with restless leg syndrome, or vibration pads to the backs of the legs. And I have heard about vibration pads. Seems a little impractical. I think I would try that if my restless leg syndrome was much more severe than it is, because I think the pads would be so annoying that I would be unable to get any sleep either. But you might give it a try and see if you have better luck with it. And then finally, do aerobic and leg stretching exercises of moderate intensity. I guess I would definitely recommend this one, because I think stretching and just getting the heart rate up a little bit, it's always good for us. With MS, we tend not to get real vigorous exercise, but there's no reason why, even in your chair, you can't get some activity that will get your heart going. And there are actually some updates on restless leg syndrome. Research, as they say in the first bullet here, researchers are investigating changes in the brain's signaling pathways that are likely to contribute to RLS. In particular, researchers suspect that impaired transmission of dopamine in the brain's basal ganglia may play a role. And then researchers also hope to discover genetic relationships in RLS and to better understand what causes the disease. I think that alone is the most important thing. It would really be nice to know what causes these things. We all benefit from knowing if there's especially if there's something we can be doing about not just MS, but all the symptoms that go along with it, to make our quality of life as good as it can possibly be. And then other researchers are studying the role of epigenetics in RLS. So not a genetic thing, but something that's kind of on top of genetics. And that would be an environmental trigger to a genetic predisposition, if that makes any sense to you. Epigenetic changes can switch genes on or off, which can broadly impact both health and disease. Evidence suggests that iron deficiency during pregnancy, in infancy, and childhood increases the risk of developing RLS later in life. Scientists hope that understanding epigenetic changes associated with iron deficiency can offer new information on how to prevent RLS. And I think that since my brother and sister and I were all raised in the same household, eating the same food, etc., pretty much on the same sleep schedule, as far as I know, I am the only one who has restless leg syndrome. So while there may be a hereditary component, genetic component, or an environment/genetic component, you can't prove that with the data out of my family. But be that as it may. The next one says that there's also research going on why the use of dopamine agents to treat RLS, Parkinson's disease, and other movement disorders can lead to impulse control disorders. with aims to develop new or improved treatments that avoid this adverse side effect. So there you go. There's another reason to avoid prescription medications, because you may end up with a side effect in addition to the ones you already had. An unintended consequence. And unfortunately, many things that we do in life, whether they're pharmaceutical or natural, can do that to us. And there's more research, as they describe, using advanced magnetic resonance imaging or MRI to measure brain chemical changes in the brain in individuals with restless leg syndrome, to develop new research models and ways to correct the overactive arousal process. And then, of course, scientists currently do not fully understand the mechanisms through which iron gets into the brain and how those mechanisms are regulated. Researchers are studying the role of endothelial cells, part of the protective lining called the blood-brain barrier that separates the circulating blood from the fluid surrounding brain tissue, in the regulation of cerebral iron metabolism. Results may offer new insights into treating the cognitive and movement symptoms associated with restless leg syndrome. Then finally, researchers are also testing non-drug therapies, such as a compact, wearable, non-invasive nerve stimulation device designed to treat RLS during sleep. Well, we'll look forward to hearing more about some of those. Now we're going to look very briefly at a couple of sites that I found. This site is by Elsevier, and it's on multiple sclerosis, but what I found here was a preprint article. So in other words, this is being put out in advance of actual publication in a journal. And it's Restless Leg Syndrome and Fatigue in Multiple Sclerosis, a cross-sectional clinical study. And it was published on August 19th of 2023, so you can't get much more up to date than that. But here are the highlights that they cover. Restless leg syndrome is highly prevalent in multiple sclerosis subjects. Restless leg syndrome increases risk of fatigue in multiple sclerosis. Sleep disorders, sleep quality, and fatigue have strict interplay. We all live out that experience, so we know that's true. I'm not going to read through this whole thing. I'm going to link it below, and you're going to be able to read it, of course, if you want to. But their conclusion is, they've confirmed the high prevalence of restless leg syndrome in patients with multiple sclerosis, and they've highlighted the potential impact of RLS on fatigue and its strict interaction with sleep quality. Well, I would have to say they went a long way to find out something that maybe they sort of already knew. Maybe they've quantified it a little better, but I don't know that there's much there that's new. More intriguing to me is this one that was published on the NIH website. Restless leg syndrome severity and cognitive function in adults with multiple sclerosis, an exploratory pilot study. And again, this came out very recently, August of 2022. And it sounds like more follow-up will be done with it. But that one really caught my attention because I would like to know what is the linkage between the severity of RLS and cognitive function. And is it just a question of sleep quality? Because as we know, if we don't get good enough sleep and we're fatigued during the day, our cognitive functions aren't going to be what they would normally have been. So again, I'm not so sure about causation and correlation and keeping those straight. I'm just going to jump down to their conclusions. They say that their results suggest that those with more severe RLS, including worse symptoms at falling asleep and during the day while active, might experience worse cognitive function, particularly processing speed and memory. Future research should evaluate whether treatment of RLS symptoms can offer new opportunities for managing cognitive dysfunction in adults with MS. Well, that's something to look at, certainly. And for you and your own life, be thinking about that. How much detriment to your quality of life is restless leg syndrome having? Are you finding that you're having a hard time with memory or processing speed or being able to solve problems or keep up with things? Could it be at least partially due to your RLS affecting the quality of your sleep. So that's another good reason not to ignore RLS, even if it isn't all that painful or even if you don't find it all that annoying. I would have to be honest and say probably my RLS is more on the mild side, maybe up to moderate at some points. I would say it never ever has been severe. It's never caused pain. But that doesn't mean that there might not be something running underneath the surface that I can't really tell. But as far as cognitive decline, I use my brain for many things, including making this channel, and I can't really say that I've noticed much cognitive decline happening because of restless leg or even because of MS. But you need to think about that for yourself, because if there is something that you could do to make your RLS less impactful on your life, you could possibly help some of your cognitive symptoms as well. Now, where Professor G is helpful, not that he's not always helpful, but where I thought his post was helpful, he talks about things that we can do. It's always nice when we can do something to keep a symptom from driving us bats. And restless leg can definitely drive you bats, even if there's no pain involved. In my case, there isn't. It's just a kind of squirmy feeling of not being able to get my legs comfortable. I'm sure that affects the quality of my sleep, although as far as I know, I don't get twitches in the night. Once I'm asleep, it's okay. But sometimes it just takes me a while to find a comfortable position. So, of course, I want to know what can I do about it. And Professor G and others have some suggestions, and let's take a look at those right now. Now, I've only included snippets here, but his whole podcast is really worth listening to. So I'm going to link it below, and I advise you listen to the whole thing. It's very good.
Many people with MS tell me that they use CBD oil or CBD, which helps. Now, I don't know about CBD. The problem I have is that we haven't researched it properly in MS. I mean, there is a theoretical reason why it may work, and we can't prescribe it. I mean, there is a licensed formulation of CBD for epilepsy, for very rare forms of epilepsy. It's very expensive, and we don't have free rein to prescribe it. So I'm aware that a lot of my patients will buy CBD online or from various stores, and I don't recommend that because we know that those CBD oils are often contaminated, and we don't know what dose you're getting. And we do know that CBD can be hepatotoxic. So if you do start taking CBD, it's quite good to have liver function tests done before and then have them checked regularly to make sure you don't have hepatotoxicity. It's not that common, but it does occur. The other thing is medicinal or street cannabis. I have little doubt that cannabis helps people with MS. Too many people use it. There's too many anecdotes, and we actually have very good evidence that when you use cannabis extracts like Sativex, it works for central pain, and it also works for spasticity. And so when people with MS tell me that they use medicinal cannabis, either smoking it or taking it orally, I can't tell them to stop doing that because they tell me that smoking medicinal cannabis really helps them get a good night's sleep. It relieves their pain, stops their limb jerks, and they feel a lot better for it in the morning. So who am I to say to them to stop using it? So I don't openly promote it, but if people find that medicinal cannabis helps, they can take it. It's got a long history and it's relatively safe, used medicinally. The other restless leg syndrome is cramps. Now, I mean, cramps should be very easy to identify in history. It's a completely different syndrome. You get muscle cramps, usually the calf muscles, and it's usually one focal muscle that cramps. And it's actually quite common in MS. A large number of people will complain about cramps, and you need just to manage these yourself, to be honest with you, because they are a very common problem in the general population as well. So stretching the muscle when you get a cramp, or even stretching before you go to bed, can some help. I personally find if I'm dehydrated, particularly if I've done exercise, I get muscle cramps. So please make sure you drink a lot of water throughout the day. Make sure you're well hydrated. If you do get a cramp, just massage the muscle. That usually relieves it. And try not to do sudden movements in bed because that can actually trigger a cramp. And the massaging should be in a circular motion rather than going across the cramp. And it's always worth trying to hack try on your own hack and try some magnesium supplements first. I mean, my leg cramps are exquisitely sensitive to magnesium supplements. I know about this because I have restless leg syndrome, and I also found that magnesium supplements helped mine as well as cramps. So this is why I think there's a little bit of an overlap in a lot of these conditions. Just for those of you who do exercise a lot, athletes, restless leg syndrome is very common in athletes, particularly elite athletes. So I think it's got something to do with the recovery or the damage to the muscle that occurs with vigorous training. Restless leg syndrome is incredibly common in people with MS. I've just put one recent paper showing you that 30% of people with multiple sclerosis fulfill the diagnostic criteria for restless leg syndrome. This is compared to less than 10% of the general population. So restless leg syndrome is a cause of MS-related fatigue. And so if you have restless leg syndrome, you should get it diagnosed properly and managed. The reason why I feel like this is because the other, what I call restless leg syndrome mimics, in my experience, are much more common. So that particularly spasticity and pain. Many neurologists, including myself, sometimes give people a trial of intravenous iron to see if it helps, and sometimes the response is dramatic. And we think the reason for this is because there's iron deficiency within the central nervous system, and we don't check that. I mean, there are studies showing you that people with restless leg syndrome, when you do a lumbar puncture and look for iron levels in their spinal fluid, they're very low. And so the idea of bypassing oral absorption and giving a trial of intravenous is to try and address that issue of not measuring central nervous system iron. And, you know, from my own personal experience, the response to iron, when it is the reason for it, can be very dramatic.
So what do I do for this? Well, I have to agree with Professor G that magnesium does seem to play a role, because one thing I have been doing is taking magnesium supplements, which seem to help. But here's the thing that I use topically when I'm really being plagued by restless leg syndrome. I finally can't stand it anymore. I get up and I spread some of this on my knees or my ankles if that's where the problem is. This is magnesium gel. And you can also use the oil, but I find that the oil runs around too much. The gel kind of stays closer to where you put it. And that way I don't need to use so much. But I just spread it on my knees, the front and the back. And if it gets a little down my shins, that's okay too. But I really have found that overall this works better than just about anything other than the gabapentin. And I'm always so happy to find something non-prescription that works for me. It's hard to find it in the stores, I think, but you can find magnesium gel online. And if you do, I really hope it works for you, because it certainly works for me. And as I said, with Professor G saying that magnesium supplements are so valuable, I think having enough magnesium inside and out makes a difference. Okay, well, I'm just really curious at this point. How many of you have dealt with or are dealing with restless leg syndrome? Please leave me a comment, even if all you say is yes or no. What did you think about those articles that I found that connect restless leg with other problems like fatigue or cognitive decline? Let me know in the comments below, because I'd really like to hear from you. Well, that's all I have for you today. So until my next video, please do take really good care of yourself, and we'll see each other again.